Today we are going to see about the levator scapulae. The levator scapulae is a significant skeletal muscle located in the posterior aspect of the neck and upper back. Alongside other muscles in this region, it plays a crucial role in facilitating movement and stability of the shoulder girdle and cervical spine. Its name, levator scapulae, derives from Latin, where levator means elevator and scapulae refers to the scapula or shoulder blade. This muscle is named based on its primary action. It elevates the scapula or shoulder blade. However, its functions extend beyond simple elevation. Understanding its origin, insertion, nerve supply, and actions provides valuable insight into its complex role in human movement and posture. Origin. The levator scapulae muscle originates from the transverse processes of the first four cervical vertebrae, namely C1, atlas, C2, axis, C3, and C4. The muscle fibers arise from these bony projections, particularly from the posterior tubercles of the transverse processes. Insertion. The muscle inserts into the superior part of the medial border of the scapula, specifically at the superior angle. This insertion point is located above the insertion of the rhomboid minor and just superior to the insertion of the rhomboid major. Nerve supply. The levator scapulae muscle receives its nerve supply from the dorsal scapular nerve, C4, C5, a branch of the brachial plexus. Additionally, it may also receive innervation from branches of the cervical plexus, particularly the ventral rami of cervical spinal nerves C3 and C4. This dual innervation ensures proper motor function and coordination of the muscle. Action. The primary action of the levator scapulae muscle is to elevate the scapula, particularly during movements such as shrugging or lifting the shoulders. When the scapula is elevated, the superior part of the medial border moves upward and toward the midline of the body. Additionally, the levator scapulae muscle contributes to the downward rotation of the scapula during movements, such as reaching downward or returning the arm from an overhead position. Moreover, it aids in adduction of the scapula, pulling it closer to the midline of the body. When acting unilaterally, the levator scapulae muscle also assists in lateral flexion of the neck, tilting the head to the same side as the contracting muscle.